We move on now to the mind and heart connection. That's the keynote address coming up to be delivered by Professor Rick Levy. And that will be for 13 minutes, followed by 2 minutes for the chairperson's observation. Being a keynote address, we will not be having any questions from the floor. May I straight away invite Drs. Girish Patel, Prem Masand, Ravi Tuli and B.K. Bhupal. If these four gentlemen are in close proximity, may I request them to kindly join us to lead the proceedings of this session. May I invite, with great pleasure, Professor Nabin Nanda to kindly chair the proceedings of this session, which features Professor Rick Levy to deliver this keynote address on the mind-heart connection for the next 13 minutes. It's over to the chairman. Thank you.
Can you all hear me? Important topic, and it's our pleasure that Dr. Rick Levy is again here, back with us this year also. So it'll be a pleasure to listen to you.
Thank you. I want to thank Dr. H.K. Chopra, Dr. Navin C. Nanda, the entire organizing committee, and the Brahmakumaris for convening the World Congress. Next slide, please. Okay. Human genetic mapping shows that we each inherit the tendency to develop several hundred diseases and disorders, but the typical person will actually activate only 3 to 4 of these over a lifetime. The activation is achieved by a stressor specific to the disease or disorder. And the site for this is from the National Institutes of Health, Dr. Francis Collins, director, based on meta-analysis of genetic studies conducted over the last 2 decades. Next slide, please. Stressors associated with heart disease are well known, and thanks to our presenters, they have all been covered. About this slide, I would simply like to point out that everything on the list creates psychological distress. And if psychological distress goes untreated, it will eventually somatize as illness in the body. A basic tenet of mind-body medicine is disease in the body begins with dis-ease in the mind. For any illness, there is an underlying root in the mind. Find this root and pluck it out, and healing will proceed rapidly, sometimes instantaneously. Next slide, please. Today, I want to focus on the mental stressor that drives CVD, problems with love. In 2005, cardiac surgeons at Johns Hopkins University concluded their most serious cardiac cases were people with a bad genetic history plus extreme suffering in love or deprivation of love. They coined the now famous term broken heart syndrome. Studies by Campbell et al., well covered by my esteemed colleague Dr. Satish Gupta, show that people who have suffered in love or never known it are many times more likely to develop CVD. In fact, it turns out that depression, anxiety, and other psychological disorders shown to correlate strongly with CVD are themselves correlated with suffering in love. As Dr. H.K. Chopra said yesterday, it is important what you eat, but when it comes to the heart, it's not what you eat, it's what's eating you. The thing that's eating at the vast majority of people with CVD is a broken heart. India is becoming the heart disease capital of the world, in part because of the people's genetic propensity, and in part because she has a long national history of suffering. Even today, survival is an issue for most. India has prevailed because her people are hardworking, dutiful, courageous, and spiritual. India has become a culture very much determined by duty. And while duty has brought her thus far, India's perseverance has come at the expense of love. Next slide, please. The good news is, when we apply state-of-the-art clinical methods to the underlying love problems, CVD patients improve dramatically. The question was raised yesterday, can we reverse CVD? As a founder of the field of mind-body medicine in the West, I assure you we can. Much of my work has focused on the successful treatment of heart disease. My methods regularly unblock blocked coronary arteries, strengthen weakened arterial walls, restore healthy heart muscle function and electrophysiology, and more. But successful treatment requires emotional release of old emotional pain from the subconscious mind's storehouse of old memory. This requires that the patient be in a deep altered state, achieved using hypnosis or very deep meditation, accompanied by clinical guidance from a trained professional. Next slide, please. You got it already. Thank you. Few physicians outside the United States and Europe are trained in mind-body medicine. Imagine yourselves conducting a clinical interview about your patient's love problems. So Mr. Gupta comes in to see you with CVD and you say, oh, well, tell me about your love life. Yeah. Could you even get your patients to open up about it? Most will deny any problems and will fail to see the relevance. Yet, the doctor is God. Patients try to follow their doctor's advice, and knowing what you know, you can vastly improve your patient outcomes if you can find a way to intervene. In the U.S., cardiologists, internists, cardiac surgeons raise the issue with their patients, then refer them to me or someone like me. Unfortunately, in India, there aren't any doctoral-level clinical psychologists well-trained in mind-body medicine that I know of. Next slide. I would like to remedy this dilemma. I am producing a kit specifically for CVD for worldwide distribution. It will contain a short manual explaining all this in a manner that patients will accept, plus a CD of my voice with 3 different hypnotic and meditative techniques that I have used successfully on 5 continents with people of every age and culture, from the world's power elite to indigenous tribesmen. The patient only has to sit back and listen. This is a plug-and-play unit. It stands alone, does not require the doctor's time. You don't have the time. And delivers results in any language. I've recorded these in numerous languages, same effects. In addition to the plug-and-play unit, I am in the process of opening a worldwide training center outside Washington, D.C. for those who want specific training in mind-body medicine. I am also forming a foundation to fight CVD in India, with 10% of profits from sales worldwide going to India, where the unit will be sold at reduced cost. I look to the esteemed members of this Congress for input and guidance in this effort. Now is the time when cardiology and cardiac surgery are recognizing that loss of love and deprivation of love are indelibly linked to the cause and treatment of heart disease. Conventional cardiology and cardiac surgery continue to advance wonderfully. Cardiological mind-body medicine has also made great strides. Imagine what we can do to trounce CVD in India when we effectively combine the two. Thank you.
Dr. Rick Levy, please join us here. I think Rick has finished 2 minutes earlier. This is a very important keynote address. Ladies and gentlemen, heart-mind connection is a new incoming information. There is a very nice book published last year by Leonard Lopai from Cape Town, South Africa. He's a cardiologist, and subsequently published 7 books on heart and drugs from Oxford University. And then he recently moved to Harvard, and he met the leaders of thought. So a cardiologist is having some undertraining in the leader of thought. In 2012, he wrote a book on heart and mind connection. I think what Rick has just mentioned, we have to change our autonomic nervous system to be in the parasympathetic mode and not in the sympathetic mode. If we are in a sympathetic mode, we should learn how to pacify the sympathetic mode. And he also mentions that even genes can be pacified. They get agitated at times. They become very aggressive. And I think the methods are, all the 3 which are mentioned by Leonard Lopai are 3M. Mindfulness, meditation and medication. When we talk of beta blockers, it's nothing but to reduce the sympathetic tone. That's it. Then we have a huge data, which we can do by natural methods. I think it was a very beautiful keynote address. I'll request Naveen to make a comment. Naveen.
I think that was really very nice, Rick. I enjoyed your talk very much, and I think within the context of this venerable institution, this was a very relevant lecture. And we know for sure, I mean, all of us are very aware of Takotsubo syndrome, but as you know, it's a completely mind-body connection. You have someone who is grief-stricken, and you can see that there's no cardiac disease and there's LV dysfunction, especially involving the apex. So, and then over time, it gets cured. But in the meantime, you can get a lot of complications from that. So we all know the connection, and this is just one part of it.
I agree with Dr. Rick, and I always think 2 emotions govern the life. One is love, and other is fear. And that is why we say ill. I lack love. And when love is there, healing will be there. I will finish with word life, L-I-F-E. Infinite flow of energy, which is called L, love. Thank you very much.
Ladies and gentlemen, may now request the chairpersons to kindly don the medallion and bestow the citation on Professor Rick Levy. I'd like to request the chairpersons, Dr. Chopra, Professor Nanda and Dr. Masan. And we have a scroll that's been prepared in the honor of Professor Levy. Thank you very much, Professor Levy, for delivering the lecture, and to the gentlemen for chairing the proceedings of this session.